This is my audience. Hi, my name is Musa Malik, and I'm a PACE intern. And this year, I interned at Integrated Primary Care under the care of Dr. Zaidi and under his instruction. So, one of the biggest problems I found in my clinic was that a lot of patients will come in with the problem of diabetes. Like, I would say over half the number of patients that came in had this problem, more than any other thing that I saw. So I decided that I would have to make a case study about this big problem. Why was it so prevalent? Why was it the most reoccurring thing every single day I saw the most? So I decided to make my case study about diabetes. So first I had to plan a medical approach. How would I address this issue? So I decided to take a combination of qualitative and quantitative research and use that as a means to, and combine those things as a means to determine how I would go about doing this project. So I decided I would take interviews with patients and talk to them one-on-one, as well as make graphs that would show the correlation between different factors when addressing this issue. So the next step, step 2, was to research the issue. I had to figure out what was causing diabetes, why was it so prevalent in our society. So through research I found out that one of the biggest things was our sedentary lifestyle that the American population has come to accept. Like this high consumption of high calorie foods with low nutrients such as McDonald's and other fast foods led largely to contribute to this big problem because of the convenience and affordability that it gave to the population. And I found out through the National Diabetes Association that what happens through type 2 diabetes is that like the insulin stops, the liver stops producing insulin, which leads to this huge problem. And I decided that I also found there are 2 types of diabetes which I didn't know before. There's type 1 and type 2. And so I found out that type 2 was the large majority of the problem, so I focused my case purely on that after researching the issue. So step 3 was my hypothesis. I had to narrow down which factors that I believed were the largest contributors to this problem and where the discrepancies occurred. So I researched the issue, the 3 major things, which were age, sex, and prior health conditions. So I looked at which age groups were the most affected, which sex, male or female, which one had the highest, which ones were more at risk, and if drinking, heart disease, high cholesterol, high blood pressure, and smoking had any correlation with people who had this problem with diabetes. And then I made a graph that showed like the increasing trend of people with diabetes in the American population as well, to show how much our society had changed. So step 4, I collected our data. First I had to gather a diverse group of people. So I used I randomly collected data from a large group of people, and I selectively chose a few to create my graphs. So that was my step 5, is where I analyzed the data that I collected in order to determine which factors I see had correlations. So we see that males and older age groups were the most affected. And in my other graph, you can see that people with prior health conditions such as high cholesterol and high blood pressure were the most likely to have other problems as well, had diabetes, which was shown in our previous research in step 2, where we found that most people who had those problems, 75% of them also had diabetes as well. So these are all like large contributors to the problem. And in step 6 is my conclusion. I sat down with my doctor and I talked to him like how exactly can we solve this problem? Like, what's the medication? Like, what can we give them? And the truth is, no like one single contributing factor or one way to control this. The best way is by educating people, by spreading the information, and by telling the population and letting them know that we have a problem. The best way to do that is by informing them about these 5 big rules about drinking a lot of water, having clean food, having moderate exercise in your life, sleeping the right amount, and just being overall happy. All these things can contribute to decreasing this problem, and that's the way how we're going to bring about change. Thank you for listening.